Hello, good evening, everyone. We are
Mm,
back with Dr. Lim again. Is going to share about why I'm seeing mosquitoes. From our last session, actually, Dr. Lim shared about the 20 visions, which means every 20 minutes, you take a 20-second break to look at a 20 feet distance, right, Dr. Lim?
yes, that's right.
Hi,
Mhm.
Dr.
Hello,
Lim.
everyone. Hello.
Thanks for joining us after
Mm,
your session, seeing your patients.
yes,
So,
okay.
okay, beside floaters that we were talking about, which is Fei or what
Mm,
we call in another term, which is mosquito, you will also share about a bit more about glaucoma, which is
yes.
also another eye disease that will actually lead to blindness. So I
Mm,
would like to find out a bit more from you, Dr. Lim. What is glaucoma? Which I think a lot of people will not understand what is glaucoma.
okay.
Mm.
Glaucoma is generally an eye disease where the eye pressure is actually too high. Uh,
Okay.
so,
So,
sorry.
sorry, continue, Dr. Lim.
So
Sorry.
this high eye pressure, if you don't attend to it, after some time, it will start to cause damage to your nerve, the optic nerve in the eye. So
Okay.
you will progressively lose vision.
Okay.
Mm,
So, okay, can I say like because what we understand a lot for Chinese, they will understand is 青光眼 nah,
yes,
right? 青光
yes,
眼.
correct.
So doesn't mean that you actually see your vision is green,
Mm,
but it's
mm,
because it's due to the eye pressure in the
yes,
eye is
correct.
high, which actually would cause the effect. Now, what actually is there any like sign or symptoms, for a person to know that they actually have this glaucoma?
Okay. Well, glaucoma can broadly divide into two types.
Mm-hmm.
Uh, the more common type is what we call chronic glaucoma, whereas the other type, which is not so common, is called acute glaucoma.
Mm.
Now, for the more common type of glaucoma, the chronic type of glaucoma, unfortunately, there are no symptoms in the early or even in the intermediate stages,
Okay.
because the damage to the vision actually happens progressively, slowly, and the damage to vision actually happens. It happens to your sight vision first, or what we call the peripheral vision.
Mm.
So when your peripheral vision is damaged, many people they don't notice it in the initial stages, because usually when we look at things, we tend to use our central vision more.
Mm.
So by the time the disease has progressed and has destroyed all your peripheral or sight vision, then only it will start to damage your central vision. And that's the time that usually people start to notice that something is wrong.
Okay.
But by that time, usually the disease is very, very advanced already. Now, the other type of glaucoma, what we call the acute type, okay, that will produce very, I would say, very striking symptoms. Because when the acute glaucoma attack happens, the person will experience a very sudden blurring of vision with severe pain in the eyeball and also a very severe headache.
Okay.
Yes, so that is definitely very symptomatic.
All right. So in this case, the like you said, the damages on the eye is actually permanent damages. Is there any cure from the damages
Yes.
or
Okay. Unfortunately, the damage caused by glaucoma is permanent, because the damage caused by glaucoma is actually damage to your optic nerve. So
okay?
optic nerve is something which, if it's damaged, it cannot regenerate.
Mm.
So if you have glaucoma and your optic nerve has been damaged, what we can do is to start treatment to control the disease, control the pressure, so
Mm.
that no further damage occurs. But
Mm.
whatever damage has happened, whatever vision, how much vision has been lost, unfortunately, that is not reversible.
Mm, I see. Okay. So most importantly, okay. So how do we actually know? Since like you say, the first type is no symptoms,
Yes,
right? So unless they come and have an eye check,
yes,
so
correct.
would it be because like inheritary, or is it because due to some medication or some other health condition that actually would cause this glaucoma?
Well, yes, there are some conditions which would make your likelihood of having glaucoma higher.
Mm.
One would be, as you mentioned, genetic factor. That means
Mm-hmm.
if you have someone in your family, it may be your parents, maybe your
Mm.
siblings, brother or sister. If there's anyone in your family who has glaucoma, then you normally you will have a higher risk than normal. than the
Okay.
normal population to also have glaucoma.
Mm.
So yes, if you have a family history of glaucoma, eye screening or eye examination is definitely warranted. And then sometimes if you have other problems like, for example, if you have diabetes, yes, your risk of getting glaucoma is also higher compared to the normal population.
Mm.
There are also other risk factors. For example, some people, they are very, their eye is very hyperopic. Hyperopic means that they have a high degree of what we call farsightedness. So this sort of eyes, the eyeball tends to be short, and it may predispose to the acute glaucoma, which I mentioned earlier on.
Hyperopic means it's Yunzi,
Yunzi,
right?
yes, correct.
Yunzi. It's a lot of people would mistaken it as low-far or low-far as hyperopic,
Yes, I know, I
right?
get that quite often.
So it's actually two different problems.
Yes,
So it's
actually two
actually the
different
eyeball
things.
is actually shorter.
Yes, correct.
Right.
Then there are other things as well, like for example, if you have had a history of injury to the eye before, there's a possibility that the risk of getting glaucoma in that eye is also can be higher than normal as well. And then some people who self-medicate, they go to pharmacy and they buy eye drops and they use it long term without actually knowing what it is and what the possible side effects are.
Okay.
Some of these eye drops can actually cause glaucoma if you use it long term.
What kind of eye drop? Is it like steroid eye drops?
Yes,
or?
exactly. Steroid eye drops
Okay.
are the ones that cause glaucoma in many people when they use it long term.
So it's best not to just simply grab the
Yes, of course.
eye drops because you wouldn't know that whether it contains steroids, right?
Yes, correct.
Okay. But what about those oral steroid medication? Would it actually cause glaucoma as well?
Actually, steroids in any form, be it topical eye drops or even oral, the one that you take by mouth, or even like creams which you apply, or sometimes even the what you call the steroid spray for the nose. All these, they have some potential to cause glaucoma.
Okay. So for those people who are on long-term steroid medication, be it is topical or oral, it's always best to also get your eyes checked as
definitely.
well. I believe Dr. Lim, like because I think one of our sessions, you did share like the steroid medication will also cause cataract as well, right?
Yes, that's another thing.
So it actually induced many other problems as well. So okay, like for glaucoma, if let's say a patient is glaucoma, would they also have this floaters problem as well, like the mosquito or 飞蚊症 problem as well?
Well, actually floaters and no, floaters is actually not a symptom of glaucoma. Actually, it's got nothing to do with glaucoma.
Yeah, but would they also encounter this? I mean, would they
yes,
also
of
have
course.
this?
A patient with glaucoma can encounter floaters as well,
Right?
Because floaters has got its own set of reasons.
Okay, so it doesn't omit that, right?
No, that's not. Yeah.
But it will not cause the floaters, right?
No, it does not. It does not cause floaters, in other words.
Okay. So let's say for a person who has glaucoma and already detected they have glaucoma, so is it advisable if let's say they have cataract, would it actually worsen the condition for glaucoma?
Okay, sometimes cataract sometimes can worsen glaucoma, especially if the person has got like a shallow anterior chamber. That means the eyeball is on the short side, or sometimes they have what you call a narrow angle of the anterior chamber. That means the area within the eye where the water flow, where the internal fluid of the eye flows out. If that area is narrow, yes, cataract can also worsen the glaucoma under such conditions.
Okay.
Yes.
So, okay, back to your question, back to just now what you mentioned about the second type of glaucoma, which is the acute one,
Yes, acute.
which patient will feel the pain in the eyeball as well, like headache, or some may actually deem it as migraine, right? So, if let's say they have this would it be either symptoms or they will have this both symptoms?
Oh, they will have both.
They will have
They will
both.
have, yes. It's blurring of vision together with the pain in the eye and the headache, actually.
Okay. So normally it will like be constant pain, or it will be like pain and then it stop, pain, it stop.
No, usually it will be pain. It will be constant pain.
Constant
It will be
pain.
constant. It may even be worsening pain.
Okay. So for those who actually encounter this kind of symptoms, please don't wait. Come and consult an eye doctor to find out if you have glaucoma or not. Now, so if patient have this acute glaucoma and they have this constant pain, I believe the eye pressure is very high that is causing that
Yes,
problem, right?
correct.
So what would be the treatment plan for, what can it be done to reduce this pain or the eye pressure?
Okay, well, obviously here the urgency in such a condition, the acute glaucoma, the urgency would be to reduce the pressure, the eye pressure as soon as possible, because the pressure is at that high level, the more damage your optic nerve is going to suffer.
Okay.
Well, when the patient comes in, the first thing, of course, we must try to reduce the pressure by usually by conservative means first. It means we use eye drops and maybe even give oral medication to try our best to bring down the pressure. And sometimes we can also do some simple laser procedure, okay, to what do you call it? To like widen the angle of the anterior chamber to allow the fluid, internal fluid, to flow out easier.
Okay.
Okay, these are some of the things that we can do in the acute stage. But then in most of the time, most of the cases, the long-term management is actually like most of these cases there is some element of a cataract there, which worsens the narrow, the what you call the narrowness of the angle of the anterior chamber. So a long-term solution is would usually see us advising the patient to have the cataract removed.
Okay.
Or if there is really no significant cataract, patient is still relatively very young, then they may undergo a laser procedure, what we call as a peripheral aeridotomy.
Okay.
That means we use laser to actually like make a hole at the side of your iris, which will actually serve to facilitate the water outflow out of the eye, you see, to relieve the pressure.
That would be a simple procedure, right?
That would be, yes, relatively simple compared to surgical.
Okay. But if let's say the patient do have cataract and the cataract has been removed, will it actually resolve this glaucoma problem or it will not? It will just improve the condition only, right?
Well, if the patient does not have a cataract, they will not suffer from this acute kind of glaucoma.
Okay.
Because patient, if they don't have a cataract, they have a lens implanted inside. Usually the anterior chamber of the eye is very deep, so the area or the outlet for the water to flow is actually very wide. So usually the patients who have had cataracts removed, they will not suffer from this type of acute glaucoma in the first place.
Okay. Is there any surgical procedure for glaucoma procedure that actually can, treat it or cure it?
Okay, glaucoma is a condition that we advise our patients that is not curable.
Okay.
It's just like, for example, it's just like diabetes, high blood pressure, where usually the condition is lifelong. It can be controlled with medication, but you cannot cure it. For example, like diabetes, if you don't take your medications, your blood sugar is going to go up.
Okay.
You take a medication, then it's controlled.
All right.
So similarly with glaucoma, it's a condition that is cannot be cured. If you use eye drops, the pressure will come down. It will be controlled. But if you stop the eye drops, the pressure will go up again. So the way to control glaucoma is actually to control the intraocular pressure, the pressure of the eye. So as I mentioned, the first line, of course, will be just to use eye drops. There are quite a few different types of eye drops. Now, in the event that after using maybe 2 or even 3 types of eye drops and your glaucoma is so severe that the pressure is still not controlled by these drops, then the next step I would say would be to go for surgery, glaucoma surgery.
I see.
Yes, glaucoma surgery, there are actually a few types.
But that would not actually also stop completely you from continue with the eye drops, right? After the surgery?
Well, after the surgery, if your pressure can be maintained within the normal range, then yes, you can stop the eye drops. You don't need to go back on eye drops because the what you call the surgery has actually created an extra passageway for the water to flow out of your eyeball. So if the surgery is very successful, your pressure is maintained at a very low level, yes, you do not need to continue the eye drops, but you must still come back for regular follow-ups with the doctor because nothing is forever. Sometimes glaucoma, as your age increases, the condition may get more serious. Sometimes surgery initially may be successful, but as time goes on, due to your normal degenerative changes in your own body and all, what has been corrected by surgery may be worse. So you may need to be reassessed again. Sometimes you may need to go back on some drops. Sometimes you may you may even need surgery again.
Okay. So, Dr. Lim, like for those acute glaucoma, is there any specific condition that actually cause it, or it just happened like that?
Okay, most of the time, this acute glaucoma, I would say, is actually a predisposition. That means you have the person who gets acute glaucoma, they have a particular kind of eyeball shape, which I mentioned earlier on. Usually, they are
Shorter?
yes, shorter. The
Okay.
shorter the eyeball is shorter, and then they have that kind of power, what we call hypermetropia or the farsightedness.
Mm.
And yes, usually it happens in females, and
Mm.
especially Asian or Chinese females. Actually, it's actually more
Smaller
common.
eyes, right?
Yes, correct. Because
Mm.
yes, females they have smaller eyes.
Okay. So, female, be aware.
Yeah.
But it's best to get your eyes checked, right?
Yes, definitely. Because as I said, the bulk of the glaucoma, the majority of cases of glaucoma, they don't produce any symptoms.
Right.
So they can only be detected through screening, and that means you don't feel anything, but you come for an eye examination, and then we can detect whether you have or not.
Right. If let's say for a person who is not wearing glasses and they have normal condition, no health condition, what would be the baseline? I mean, what is the best age to come for an eye check to have a baseline condition?
Okay. I would say probably anytime from like 35 years old onwards would be fine.
35 onwards.
Yeah,
Okay.
35 onwards would be fine.
Okay. All right. So that would be good. So okay. So Dr. Lim have shared quite a lot. I've actually also learned quite a lot about a glaucoma, which is a condition which is something that we should not take lightly because it will actually really like lead to blindness and it's not curable when it's
Yes.
um, if your optic nerves is being damaged. So if you are interested to find out more on this sharing, because Dr. Lim will share a bit more, not only just about floaters, he will share a bit more about other eye diseases as well for this upcoming webinar on this Thursday at 8:30 p.m. Do click on the link to register. All right, click on the link to register, and upon the webinar, all the attendees were actually entitled for a free eye screening with a doctor consultation with Dr. Lim. So don't wait and then just register to join us on the webinar. If you join us at the Zoom platform, which you register with this link, you actually can ask question directly and have a direct interactions with Dr. Lim. Okay. Otherwise, you can join us at our Facebook Live or our YouTube Live on that day itself. So thank you, Dr. Lim. Thank
Thank
you
you,
for your
everyone.
sharing.
Thanks for your
So
time.
thank you, everyone, and good evening. I'm Anna from LEC Eye Centre. Thank you.
Okay, thank you. Bye bye.